Some TV shows will give you a leg up. We just give you maybe an extra foot. Mark Bradley's here from Brantford Podiatry Associates, and we apologize in advance because, well, it's time to get the sunglasses on. If you think this is bright, Mark, welcome.
Thank you. Nice to be back.
You didn't even call ahead. If we had something in probably a dark blue, you know, we'd be a singing group from the '60s.
I like it. My wife chose it, and I'm pretty keen on it.
Perfect. There you go. Listen, we're talking today about the wonderful world of orthotics. And I will tell you, you and I talked about this before we came in, because my favorite thing is, growing up when I did, I don't remember seeing anybody with orthotics unless it was a severe handicap situation. Now orthotics. What have we done, or what have we learned that's caused this?
Well, like many medical treatments now, they become more accessible. We know more about them, and hopefully we're a bit better informed as to the uses of them. Likewise, when I graduated 25 years ago, there was basically chiropodists and podiatrists producing orthotics. There weren't, again, that many of them out there. And now, we have family physicians making them. You go to the local grocery store, and they have a computer diagnosing you and identifying
So what's the
your needs.
danger all of a sudden if I've got my dentist making my orthotics?
With your dentist, I'd probably have some severe concerns about. Again, the orthotic, the first thing is to understand what an orthotic is intended to do. Its purpose is to assist you function the way you're originally designed to. The musculature, the muscles around your ankle are supposed to assist you by shock absorbing, by controlling your stability. So the idea of a properly prescribed orthotic is it supports your natural bone structure as closest to your natural position. From there, the muscles can go back to doing their real job. So for it to work right, you've got to first know what's wrong, and then you can make an appropriate device.
From personal experience, my daughter played a high level of basketball and severely sprained an ankle. The result of the sprained ankle was she flattened her foot.
Mm-hmm.
Enter, I guess they call it a pronation sort of brace and orthotics. Now, did that orthotics take the place of the fact that the shape was changed of the foot because of the injury?
Well, a couple of things. In a situation like that, when there's an actual visual change, in all likelihood there was some fairly significant soft tissue damage. So she probably had some ligament damage. So the orthotic in that case, if she continues to play, is acting in the way the ligaments did to prevent that end stage damage from occurring. At the same time as trying to improve her function, improve her stability, and make her perform better. Now,
you brought some demonstrators here. What are we looking at here?
Well, the first thing is where a lot of people ask, what's a real orthotic? What would it look like? And, orthotics, there's a sliding scale. On one end of the orthotic scale, we're trying to correct and stabilize and improve function. Generally, with a device like that, the material needs to be strong enough and robust enough to withstand the sort of pressures we apply to the ground. So it's about 1.5 times your body weight. So in a lot of cases, we'll use like a material that's graphite. It's fairly strong. It's intended to match your body, so it's semi-rigid.
Is there still some play, Mark?
Oh yeah, there has to be.
Right.
It's part of your shock absorbing
Right.
mechanism. We're not trying to rigidly hold your foot. In some of our patients, we're trying to cushion and palliate and deflect pressure. And those devices typically are much more soft material. Their aim is less functional. But by and large, for most people that are active, we're looking for a semi-rigid device unless they're a very high-level runner or sports person, and then we'll soften the material up accordingly.
Present company accepted. As a society, we're getting fatter. Has that made business pretty good for you? Because you're talking about, it sounds like all of a sudden the feet are being called upon to handle more weight than maybe they were designed to.
Absolutely. Again, I mentioned earlier that there's a direct link between the force of our foot striking the ground and our body weight. Likewise, we become taller, and the longer the limb, the greater the energy that's produced. The environment, we've spoken before about the world we've created for ourselves to live in, that also is a big effect. The other big component is where a minor mechanical instability previously wasn't a big issue, combined with poor footwear, the damage is much more rapid. But one of the areas, especially mentioned with regards to the weight gain, I see so many very, very sad situations where very young children are overweight, and the destruction that it does to the architecture of their foot's incredible.
We always run out of time when you get here, but we can tee up the next time you're going to be here because we're going to be talking about technology is going to help diagnose this. Mark Bradley is our guest, Brantford Podiatry Associates. We're done. We're coming back. We're going to see you right here in the middle of the work week. And thanks as always for doing it inside Brant.